despite the White House calling the announcement a historic progress in fighting autism, experts say, as you heard from Vanessa Mott's story, more research needs to be done. Join us now to discuss is family physician and national expert in brain health, Dr. Georgine Nanos from the Kind Health Group. Dr. Nanos, thank you so much for being here.
Thank you, Teresa, for having me.
Our pleasure. We just watched that report together. This is a big claim from President Donald Trump and the administration during that press conference. And from what you saw, did this press conference provide any proof of evidence that acetaminophen is linked to autism?
No, it did not. It did not prove any, it did not show any new evidence. In fact, what it cited were some of these studies that we already have that show an association but not a causation. So it's really important to make that distinction, especially when this is such a high stakes conversation. So just because two things, an association means something is statistically linked and happening at the same time. Let's say, for example, in the summer, the rates of eating ice cream go up. The rates of heat stroke also go up in the summer. Those two are associated. It doesn't mean that eating ice cream causes heat stroke. That's an association. To say that there's a causation means that something absolutely causes that. And there's no evidence to support this. In fact, we've looked at massive studies. There's a very huge study out of Sweden from last year, the Swedish sibling study. They looked at 2.5 million children that were related, which is a really massive study, and that there was no causation between Tylenol and autism in that study. In fact, they did find some association, but when they controlled for other factors, that association went away. So it's really important to look at the rigor of these scientific studies and to see, and what we know is that there is no causation. So this doesn't change anything from the physician community, the medical community, in our view. Unfortunately, it stokes a lot of fear and concern, which is especially difficult for women who are pregnant and women who have children with autism who now feel like they have some guilt, which is also really unfortunate and shouldn't be the case.
Yeah, let's talk about that. Should new moms, women who are pregnant right now, should they be worried? Because this is coming from the Trump administration, and now there's discussion between medical experts.
So I think it's really important for pregnant women and new moms to, if they have questions, consult their physicians, their healthcare providers. But in my view as a physician, and I think in the view of the general medical community, this doesn't change anything for us. We always recommend to patients, if they're taking a medication, to take the lowest dose for the shortest amount of time to treat our symptoms, There's also, and I understand there's so much frustration from parents because there is this sense that autism is in fact rising, but there are a lot of reasons for why it looks like that. We have expanded the diagnosis for autism to include many more conditions. We are also much better at identifying it much earlier. We have better diagnostic tools. There's much more awareness. So the tent under which autism spectrum disorders fall is much, much bigger than it used to be. And it makes it look like autism is rising at a precipitous level. In fact, it's probably not really rising that much. So.
What was your reaction when you heard this claim today, and what will you tell patients when they come in to your office and ask you about this? What would you say to them?
I would say we know that Tylenol does not cause autism. We also know vaccines don't cause autism. We know these things already. This is scientific evidence that has been studied with lots of scientific rigor for decades. And that we know because it's been looked at by the medical community. We care about our patients and we want to do right by them. And physicians we took an oath to not do harm. And so we take that very seriously. And I think we're doing more harm by creating fear and stoking fear in the public opinion. And this is a very sad day, I think, in fact.
All right, Dr. Nanos, thank you so much for being here, weighing in, discussing the latest claim from the Trump administration that Tylenol is linked to autism. We appreciate it.
Yeah.